I want to finish off uh, with our discussion on LGBTQ addiction issues. So, what we need to be aware of is that there certainly still is the stigma around, and you can see here in quotes, it's homosexuality. So the idea that folks still struggle with this being a stigmatizing term, and people still believing that this is a lifestyle choice, and people still believing in conversion therapy, and the idea that there's still some systemic issues around just overall and general acceptance. As an example, gender identity disorder is still classified as a mental disorder, and then of course transgender identity is a medical condition, as opposed to just a way of being a human being. And so when working with LGBTQ individuals and addictions, you have to remember that there is this stigma, and there is this, struggles that could certainly be a very convenient reason why someone would want to self-medicate and continue to use. So again, and kind of like what I was saying is the video cut off, the first video cut off. It's up to you to be aware of the terminology. The terminology is ever changing, and because we are learning so much more, and I think it's up to you to be mindful of the correct terminology. And if you don't know, there's nothing wrong with admitting, what is your preferred pronoun. So if you're sitting across from a client and you're not aware, you just say, what is your preferred pronoun? If a client has a request a different name than what their name was at birth, you use that name. I have unfortunately worked with individuals who refused to call a client by their name, their chosen name. Let's say someone who was going through they were transitioning, and they were transitioning, and part of that transition was to start going by their new name, and being called by their new name and preferring that new name. And I've worked with folks who just refuse to do it, and that's just not ethical. There's no other way around it. It's just not ethical. And so it's up to you to make sure that you are aware and that you stay educated, and that you have these conversations with your client, and have your client even help you be more aware and more informed, if at all possible. I think it's important also for us to know that just the idea of and process of coming out in and of itself can be very stressful and very taxing and very confusing for a client. And so it's important for you to know what stage of sexual identity development your client is in. Where are they in the coming out process? And does this have a role or play a role in their use, or their wanting to use, or their needing to use? Again, you can see here some variations, and these are changing rapidly and frequently, and so it's important for you to be mindful of that. I think it's important in assessment. There are some assessments that cater to LGBTQ population, and are more aware of that heterosexual bias and some of the specific traumas that LGBTQ population and struggles that they may go with that may impact or affect their youth. We talked about this part here, language, affirmative language. I think the third bullet point here, go to the second one. So sex plays the same role in all of our lives, regardless of sexual orientation. So be mindful that that is an important aspect, regardless of our orientation. And then going to the next bullet point, knowing that coming out is a complex process, and it happens over their lifetime. It doesn't just happen and then that's the end of it. It's not this sort of static, okay, it happened, it's over with, and so now you don't have that struggle, or now we can work on that struggle. That's just not the case. It happens over their lifetime. And I think, again, being sensitive and affirming to the names and terms a transgender person uses to describe themselves, is important. And I think also even just the idea of transgender versus transgendered. If you have an ED on the end of that, that's as if it's done already. So in the past, transgender is not in the past. So little things like, well, it's not little, those are very big. Things like that, you are expected to be aware of. So treatment for addiction, there are some treatment centers who specialize in LGBTQ population, but those are few and far between and not often covered by insurance, just because usually ones that are covered by insurance have to be more, or they require them to be more inclusive and don't really take into account the specific issues and concerns that LGBTQ treatment may present. So you may have a hard time finding treatment centers that are specifically geared for LGBTQ population, but know that that is incredibly important for the comfort of your client. If your client's not comfortable in discussing their specific issues and concerns in treatment, then treatment's probably not going to be very effective. So that, you know, this is an important consideration. I always, in this bullet point, I always go to that chosen family and close friends. Make sure that we are not defining for our clients who their support system needs to be. Their biological family may not necessarily be their chosen family, and you ask those questions and you use their identification of their family or their definition of their family, not what you assume. And I'm just kind of going through here. There are some 12-step and AA meetings specific for LGBTQ, and those are, if you guys looked at the AA and 12-step meeting sheets that you can find on the website, then you would have seen that there is an icon or a little sort of signifier that specifies that this is an LGBTQ meeting. So that way, if that's the meeting you were looking for, you would know. Relapse prevention, again, making sure that you're aware of those systemic traumas and making sure you're aware of coming out issues and any any grief and loss, any self-esteem, any transitioning issues or concerns. These things need to be discussed and put into a relapse prevention plan. And then, of course, the role of their family. Their family may or may not be supportive of them, and so that's really important as well, and would be a common relapse trigger. You know, this follow best practice guidelines. I don't know how many times in these last two videos that I've mentioned, you know, it's up to you. It's up to you to be informed. It's up to you to be aware, and it's not up to you to refer out just because you don't know. And then, of course, we're advocates for our clients, and that doesn't just mean the clients that we feel comfortable advocating for. We're advocates for all of our clients. So I'm gonna end at that.